My name is Mariam Aziz. I'm a psychosexual and relationship therapist. I started studying sexuality and sexual health back in 2009. And my interest in the field grew, and I did some research on the lack of sexual health education in Egypt and the implications of that on how people learn and where they get their information from. I then studied at the University of Michigan and became a sexual health educator. From there is where my interest in therapy started to rise. Whenever I would give a session or a workshop or just talk to people, friends and acquaintances, the questions that would come to me weren't just about information. People had real struggles and real issues in their relationships and sexual lives, and I wanted to be able to help them. When I get a couple or even an individual as clients, it is important to me to see them and for them to see their struggle, not just as a struggle with sexual issues or in their relationship, but as a struggle as part of their own psychological growth and wholeness. The word wholeness is also important to me in understanding how I work with clients. بالنسبة لي مش بقدر أفصل ما بين إن البني آدم عنده أفكار وعنده مشاعر وعنده جسم، والحاجات دي مرتبطة جدا في بعض. فنوع therapy that I practice is called integrative therapy, which means I bring together different schools depending on the issue the clients are coming with and the clients themselves, really. So sexual difficulties, everything from erectile issues, ejaculation issues in men, low desire both in men and in women, whether it's low desire, low interest and arousal, as well as pain that arises during sex and especially during intercourse. I also work with women who have a hard time reaching orgasm. I also work with clients who have out of control sexual behavior, وفي مصر ده بيبقى معروف أكتر بالإدمانات الجنسية أو addiction, as well as people who have issues in the relationship in general. Maybe it has to do with a lack of sexual intimacy during certain seasons of life. واحدة من الcommon مثلا after having a baby and not feeling very intimate together. It's very important to me as originally a sexual health educator to integrate education, psychoeducation and sexual health education into my practice. مهم بالنسبة لي إن إحنا قاعدين بنتكلم نبقى فاهمين أحسن إحنا بنتكلم على إيه. For example, I use models to explain to clients what the different parts of their genitals are and what their function is and how understanding their bodies and the bodies of their partners impacts their sexual lives. I know and appreciate that sexual issues especially can be hard to talk about, but if you are struggling with sexual difficulties بكل أنواعها المختلفة أو بمشاكل في العلاقة عامة, there is no shame and there is no embarrassment in talking to professionals who would be able to help you. We are here, and O7 is the platform for that.